Who is it?
It's Jenise. Is it okay if I come in?
Yeah.
Hello.
Hi.
Hi, my name is Jenise, and I'll be your nurse this afternoon.
Okay.
Could you tell me your name?
Casey.
Hi, Casey. It's good to meet you. I'm just gonna do an interview with you, kind of a health history overview with you, just to get a understanding about your medical condition. Is that okay?
That's fine.
Casey, how old are you?
25.
25. And are you married or single?
Single.
And what do you do for a living?
I'm a CNC machinist.
Where do you work?
I work at Boeing.
And your current living situation, do you live at home? In a home, do you live in an apartment?
I live in a home in Auburn, Washington, by myself.
Okay. And what's your ethnicity?
Asian, specifically Filipino.
And are you taking any medications right now? Any prescriptions or over the counter?
Occasional Benadryl, Tylenol, and I'll take over the counter hydrocortisone for my skin.
Okay. What do you take the Benadryl for? Usually allergies?
I'll take it for allergies. I'm allergic to pet hair, so they're dander. Freshly cut grass.
Okay. And what do you take the Tylenol for?
The occasional headache or body pain on my day-to-day life.
Okay. Sorry. So, when you say occasional, what does that mean?
If and as needed.
Okay. And do you take it frequently?
No. Maybe once every two or 3 weeks. Just depends on what I do at the gym or at my work.
Okay. And the hydrocortisone?
I have a light eczema on my certain parts of my body, so.
Okay. And you said you were allergic to pet hair and dander and not dander, freshly cut grass. What kind of reactions do those cause?
I'll get teary eyes, runny nose, and itchy skin.
Do you get a rash or anything like that? Or does it just feel itchy?
No, it just feels itchy, no rash.
And then do you get any swelling of the throat or anything like that?
No.
Okay, and the same reaction occurs for both things?
Yeah.
Okay. A review of your health history. Have you ever been hospitalized?
No.
And have you ever had any surgeries?
I've had my wisdom teeth taken out.
Okay. Anything else?
No.
And how long ago did you get your wisdom teeth pulled?
I had my wisdom teeth taken out 2 years ago.
Okay. Do you have any history of or current medical conditions?
I have light asthma and eczema. Which I'm here for. Asthma.
You're here for asthma?
Yeah.
Okay. I'll get there in a second.
Okay.
So, how long have you had asthma for?
As long as I can remember. So, when I was a young kid.
Okay. Did you take any medication for it? Do you still take medication?
I do not currently take medication for asthma. I used to use a nebulizer and an inhaler.
And how long ago has it been since you used either device?
The inhaler, I think last time I used it maybe 5 years ago, and the nebulizer, not since elementary school, so 10 years and more.
And you said you used the hydrocortisone for eczema. Do you currently have eczema?
Yeah, I have minor eczema in my forearms and the back of my neck.
Okay. And just to review your family history, does your mother or father have any current or history of health conditions?
My mom has high blood pressure, eczema, and asthma, and my father has high blood, eczema, and asthma, and he specifically has gout.
Okay. Um, do you have any siblings?
Yeah, I have two siblings, two younger siblings, one girl, one boy, and they both have asthma, eczema, and high blood pressure.
Okay. What are you seeing this for today? You said you were seeing this for asthma.
Yeah.
Could you tell me a little bit more about that? Are you experiencing symptoms?
I'm
Anything that makes you think that it's asthma?
having shortness of breath. I'm having some chest pain as I breathe. Some sharp pain going on right now.
Could you describe your chest pain?
They're in the sides, so side of my ribs. Every time I inhale, it hurts. I get this like sharp pain going through, and then I just have a hard time breathing.
Is there anything that makes the pain better?
Doing nothing.
Doing nothing, and anything that makes it worse?
Moving around, so like running or even just walking makes it difficult.
When did it start?
This morning. So I went to a marathon run this morning, and afterwards I started feeling the symptoms.
Okay, and if you could rate your pain on the scale of 0 to 10 right now, 0 being no pain and 10 being the worst you ever felt, what would you rate it at?
A 6 right now.
At rest, and then when you said it gets worse when you're doing any kind of physical activity, so does it, what level would you say it's at when you're doing activity?
I'd have to say 10 out of 10.
And you said it's on the sides and
Yeah.
a sharp pain.
Mm-hmm.
Okay. Are you having any other discomfort right now?
No.
Okay.
Well, I have a little bit of a headache. I'm kind of dizzy.
Headache and dizzy. Did that also occur today? Start today?
Yeah.
Okay. Are you having any numbness or tingling in your hands or your feet?
No.
Any history of seizures?
No.
Okay. You said the pain is here. Are you experiencing any pain towards the middle of your chest?
Maybe a little bit as I, inhale and exhale, but it's primarily on the side.
Okay. And then, could you describe your exercise? How much exercise you get in a day? What you do?
I work out at least 4 times out of the week, Monday through Friday.
Okay.
Each session is about an hour and a half. Some light cardio and moderate weightlifting.
Okay. And then, how would you describe your diet?
Fairly good. For 5 days out of the week, I try to eat lean protein, high vegetables, whole grains, and fruit. In the weekends, I like to have like a high carb meal, like pretty fatty, and a couple drinks of alcohol.
Okay. Do you regularly drink alcohol?
I have like probably at least maximum 2 beers every weekend.
Every weekend. Okay. How long have you been doing that for?
Since I turned 21.
Okay. Alright. And how are your bowel movements? Are you moving your bowels okay pretty regularly?
Yeah. No diarrhea, no nothing like that.
When was your last bowel movement?
This morning.
Okay. And then, what about urinating? Are you urinating okay?
Yes. I drink water. I drink a lot of water throughout the day.
Any issues, any pain or discomfort when you urinate?
No.
Are you sexually active?
Yes.
Do you currently have a partner or more than one partner?
Just one partner.
One partner. And are you practicing safe sex practices?
Yeah, condoms.
Any muscular pain? Any joint pain?
I have some lower back pain, dependent on my day to day. What I do.
You're experiencing that right now?
No, not right now.
Okay. How often do you experience that pain?
It's just dependent what I do my day. Like if I go to the gym, and I work on my back, I'll have like a little lower back pain, or just depending on what I do in my work.
Okay. And how do you manage that usually?
Stretching and Tylenol.
Okay. Aside from the eczema that we talked about before, are you having any other skin issues, rashes, bruising, any injuries?
No.
Okay. Just to review, so you're here for asthma. You're experiencing some chest pains, kind of both sides. It's a sharp pain. You're at about a 6 out of 10 right now. It gets worse with physical activity. Better when you're at rest. You started today. Anything else everything else seems to be doing okay. You said you are having some headache and dizziness, but no other pains. You have occasional back pain. Your diet is pretty healthy. You're eating lean protein and vegetables during the week. You have about 2 beers every weekend. Doing okay with bowel and bladder. No issues there. As far as your family is concerned, your mother and father both have history of high blood pressure, eczema, asthma, and your father has gout. Your prior history, you have had asthma before. This is not your first time. You also have a history of eczema. You're allergic to pet dander or pet hair and freshly cut grass. No other, you take over-the-counter medications, but no prescription. The Benadryl for allergies, Tylenol as needed for aches and pains, and hydrocortisone for your eczema. Okay. So I'm gonna go ahead and put this in your chart, and I'll let your doctor know. Do you have any questions?
No.
Okay. Is there anything else I can do for you for right now?
No.
All right. Well, thank you. I appreciate it.
Thank you.